Pam, this is actually her second time with us. She was here early on with my vision show talking about ocular surface and its relationship to beauty products. And we're just so excited to have people, doctors from the industry, sharing some of the impacts of beauty and wellness and vision and how these things connect. So, Dr. Theriot, I'll leave it to you. Thank you so much for being with us today.
Thank you. I'm so glad to be here, excited to share this knowledge with everyone. There's so many things going on in the dry eye space. That's what I specialize in. And we are just about to launch the new Tear Film and Ocular Surface Society's workshop. So I am on the Public Awareness Committee of the Tear Film and Ocular Surface Society. They are probably most famous for the DEWS 2 report, which is the dry eye workshop, which was released in 2017. It's kind of the Bible that doctors use to diagnose dry eye and know how to treat it in a kind of a cookbook form. So it is considered to be the most knowledgeable reference for dry eye disease. So in 2021, the committee decided to launch a new report. It's called a lifestyle workshop, ocular surface disease, because we're finding that the lifestyle that we're living now in the 21st century is really leading us down the path of having many different ocular surface diseases, including dry eye, because of the way we're living our lives. And so today I wanted to share with the public and with other doctors the ways that your lifestyle is affecting your eyes and what we can do to prevent it. Also, what research still needs to be done to prove what's going on and the best ways to combat it. So I'm going to be going over two of these reports today. The first is about cosmetics, and then the second one is about digital devices or your digital environment. And so we'll really dive into the aspects of your lifestyle that are creating some problems with your eyes. All right. So as I said, this is the Tear Film and Ocular Surface Society's lifestyle workshop because we consider ocular surface disease to be an epidemic in the 21st century. On this cosmetics report, we had several doctors from around the world who put in their time, effort, and energy into compiling this report. So the way that the Tear Film and Ocular Surface workshops work is that they take all of the data that is already out in the universe and compile it. So they're not actually going out and doing experiments themselves, but they're taking the data that's already out there that other scientists are doing, other clinicians and doctors that are working in clinics every day. They take all of that knowledge and put it together into a concise report. So these are the doctors that were on the cosmetics report. You may see a couple of your favorite doctors on this report. I certainly see a couple of my favorites. And I just want to point out up here in the top left corner, that's Dr. David Sullivan from Harvard University, and he was the committee head for this report. They also wanted to express their appreciation to Amy Gallant Sullivan and Jeremy Chungbo Chang from Sydney, Australia, for helping them to compile this report and make these beautiful slides. So here's an overview of what we're going to talk about in the cosmetics portion. We're going to do an introduction and then some definitions of cosmetics. We'll look at the history of cosmetics, the psychological aspects of eye cosmetics, the market and prevalence of use, and then we'll go over a bunch of things about eye cosmetics, ingredients, products, procedures, regulations, safety and terminology, and then we'll review some conclusions and recommendations. Part of this report is that they wanted to answer a question as well. So they compiled all the information, but as a separate piece of this workshop, they looked at a single question that they wanted to dive deep into. And so end of this report, we'll go over that one question, which happened to be on eyelash lengthening serums. Buzzword ladies, I know you all love them, and we're going to talk about what we know about these eyelash lengthening serums, what we don't know, and what we should do about using them going forward. So this report is going to explain eye cosmetic products and procedures and how it presents a lifestyle challenge that can exacerbate or promote the development of ocular surface diseases. So there's so many aspects of eye cosmetics that we're going to address, including history and market value, some psychological and social impacts, and possible problems associated with cosmetic ingredients, products, procedures, and regulations. So in addition, this report, as I was just saying, it's going to include that systemic review of a question. And the findings of the systemic review will highlight the gaps in what we know as our evidence-based science that has been reported, again, on eyelash growth serums. Such an important topic because people are using these growth serums and not understanding the impact it has on their eye health, because they think, oh, they're just putting it on just at the edge of their eyelid. How could it be hurting anything? But let me tell you, these lash growth serums, if they contain certain ingredients, can be very detrimental to your eye health for long term. It can damage the oil glands inside of these lids. And once we lose those oil glands, there is some evidence that we can regrow them, but we don't have a really great way to repair them and restore them to their original functioning. So that is why this is so important to get out to the public right now, so that people know that using these products does have a long-term health consequence. Okay, so what are cosmetics? So they're defined differently across the world in different cultures, and there's no global consensus definition. I mean, some of us might think makeup remover is a cosmetic, whereas some might be more traditional and think only about eyeshadows and mascaras. So there are so many different products like face bleaching creams, eyelash growth serums, primers, anti-aging creams, false lashes, eyelash curlers, makeup removers, and toners. So many different products can be thought of as cosmetics. And they comprise, as I said, a diverse array of products. Concealers, glues that we use to glue on those eyelash extensions, serums, shadows, and toners. And a number of these ingredients in these products may be harmful to the surface of the eye itself and the skin around the eye. That word adnexa just means the skin around the eye. So kind of this little mask area right here is what we consider to be the adnexa, just in case you're not in the medical field. In addition, numerous cosmetic procedures to the eye have consequences, right? We're using Botox, filler, even platelet-rich plasma injections, chemical peels, conjunctival tattooing. We do that right on the white part of the eye, eyelash curling, dyeing, tinting, perming, eyelid piercing and tattooing, microneedling, and skin resurfacing and tightening. Anytime you're changing the way the eyelids interact with the eyes, you may be changing the blink. And when we get into the section about digital environments, that blink is going to be understood as the most important function that your eyes do all day long, is blinking. So anytime you're changing the way your eyelids interact together or with your eye, that is impacting your long-term vision quality. So a number of these procedures may also be associated with these adverse reactions. So eye cosmetics go back to 3000 BC. People have used eye makeup to be able to speak with their eyes. As we all know, they are the windows to our soul. So the primary goal back then was to darken the eyes and make them more expressive, attractive, seductive, and enhance the appearance of youth and beauty. And in the 21st century, there's a thriving eye makeup industry. It's valued globally at $15.5 billion, and it's projected to exceed $23 billion market by 2028. So just in 5 short years, we will almost double the value of this market. So it's huge. People all over the world are using cosmetics every single day. There's some other statistics about how often women put mascara on their eyes. It's an average of 9 times a week, so even more than once a day. And on average, women use 11 self-care products all around their face and eyes on a daily basis. So you think about your facial wash, your moisturizer, your eye makeup remover. So we've got 3 right there before we've even started to put on makeup. Then you have mascara and eyeliner and eyeshadow, right? And you might use something from time to time, like an eyelash perm or curler or something that darkens it, some eyelash growth serums, and you see how the numbers really start to pile up. You might be using a concealer underneath the eyes, a primer to the eyelids, and these numbers of different products, each product having 10 or 20 ingredients. You see how there is an impact of these ingredients because women are wearing eye makeup every day, and they are not taught, usually from an early age or any age, what is a good cosmetic practice and what is not. And so that is what this report is really hoping, is to set a standard for that. So psychological and social aspects of eye cosmetics include variations in adults and teenagers, geographic variations, why people are using eye makeup, religious and cultural practices, and then sharing of your cosmetics. We're going to talk about that one as well. So with sharing of your cosmetics, we found that repeated use of a single cosmetic product over time introduces microbes into the container. So we have bacteria that live on our lids and lashes. They are normal to be there. They are part of our body's flora, just like we have lactobacillus in our stomachs that helps us to digest dairy. We have bacteria on the front surface of our eyes as well. And so when we touch our eyelids and lashes with eyeshadow or mascara, and then put that applicator back in the tube, you're introducing that bacteria into the container, and then it's warm, it's dark, it's comfortable, and that bacteria can really thrive. So our report noted that 79% of mascara tested positive for Staph aureus and Pseudomonas. And both of these are quite powerful microbes that, if they were to get onto the surface of the eye, could cause devastating sight-threatening ulcers, which is infections on the front surface of the eye. So the amount of product contamination is actually related to the amount of use that the product has, the age of the product, so how many months it's been used, and the number of users that are using it. So the sharing of makeup may serve as the way that bacteria gets cross-contaminated from person to person. Also, I think one thing that we really need to start educating our patients about is how often do we dispose of our eye makeup. So just briefly, our mascara in a normal size tube that you would get from the drugstore or at the beauty counter at the department store should be disposed of every 3 months, right? And that's not because we want to sell you more mascara. At least that's not why I'm telling you this. It's because of that bacteria that you're putting into your cosmetics just from your own use. Even if you're not sharing that, you have bacteria on your lids and lashes, and so you're putting it on. I don't know, you're using the mascara and you're getting some bacteria on it, and then you're putting it into the tube, and then it's growing in the tube at a faster rate than it would grow on your eyes. And so the more you use that mascara, the more bacteria you're getting on your eyes. Even if it's your own bacteria, you're just actually applying more of it to your eyes, if that makes sense. So at 3 months, you want to dispose of that and get a new tube. Okay, now we're going to take a deeper dive into the cosmetic ingredients. Now, these ingredients are necessary for cosmetics, right? They may be using it as a buffer, a colorant, an emollient, some things making the makeup softer, a pH adjuster, a preservative. Like there are reasons to have these ingredients in your eye makeup. It might be an UV light protector, a skin conditioner, a solvent, a surfactant. So we need these ingredients in the makeup, but some of them can be causing problems, right? So they are all found in all makeups: eye creams, eyeliners, eyeshadows, glues for eyelash extensions, lotions, makeup primers, removers, moisturizers, mascaras, serums, and wet wipes. So a number of these ingredients may act as allergens. You just might have an allergic reaction to a specific ingredient. Some of them are carcinogens, endocrine disruptors, immunosuppressants, irritants, mutagens, toxins, tumor promoters, and they may damage the front surface of the eye and the skin around the eye. And so we're going to go over some very specific ingredients that we need to avoid in our cosmetics and know specifically why I'm telling you to avoid those. So further multiple adverse reactions may be having in products containing these ingredients. And as I was sharing with you earlier, we're not just using one ingredient once a day, right? We're using multitude of different lotions, potions, powders, creams to beautify our faces and eyes every single day. And you can think to yourself, ladies, about how old were you when you first started wearing eye makeup, right? Some of us pre-teen years that we started wearing makeup. And then maybe more of us in our teenage years or 20s started wearing makeup on a daily basis. When we put the makeup on, we're wearing it all day long. So 12 plus hours a day, having these toxins around the most delicate part of our bodies. The skin on the eyelids is the thinnest in the body. So anything that you put on the eyelid skin can get into the bloodstream very quickly. And then these problems with causing immunosuppression or endocrine disruption can happen very quickly, and then time and time and time again, over and over and over again, we're going to be finding that you're putting these on your face and you're giving yourself another inoculation of these toxins. So here is some of the top 10 toxins that are commonly found in makeup products. Right? The first one is benzalkonium chloride. Now, if you're in the eye care profession, you know BAK as a preservative. It's almost omnipresent in our preserved eye drops. So whether we're talking about an artificial tear that we get over the counter or a medication that we're prescribing to our patients to get rid of an infection or treat glaucoma, that drop, if it's in a bottle, is preserved with BAK. Right? And so we're going to really dive into what is the problem with BAK in just a minute. Some of the others that are on this top 10 list are chlorphenicin, formaldehyde-releasing compounds commonly found in those eyelash glues, parabens, phenoxyethanol, phthalates, prostaglandin analogs, retinoids, salicylic acid, and tea tree oil. All right. So here we go. First with BAK or benzalkonium chloride. As I was telling you, it's very prevalent in eye drops. So even if you're not an eye care practitioner and you use an artificial tear just every now and again because you want to moisten your eyes, if you're getting the ones in the bottles, it's probably preserved with benzalkonium chloride. So you want to reach for the ones in the vials more often to avoid this contaminant, this toxin, okay? This one is quite a problem because we find that amounts that are 20,000 times lower than appropriate levels in eye makeup are toxic to the cornea, the conjunctiva, which is the white part of the eye, and the meibomian gland cells. So the meibomian glands are inside the eyelids, and these are the glands that produce the oil that coats and soothes the eye. And so what was found in the laboratory was that if you took a concentration of BAK that was 20,000 times lower than what you might find in an eye makeup and put it in a dish with the epithelial cells of these oil glands or the cornea, that it would actually kill the cells. And so this means the BAK reduces tear film stability. It leads to loss of the goblet cells, which are the mucus producing cells on the front surface of the eye that actually help to hold the tears onto the eye. And so it leads to a real disruption in the tear film and the front surface of the eye overall. So application to the eye may also lead to increased prevalence of irritation, burning, itching, this foreign body sensation, some redness, some scurfy stuff in the lashes, the overall loss of those oil glands, leading to dry eye disease and perhaps failure of future glaucoma surgery. Okay, so now we're talking about those formaldehyde releasing compounds. As I was saying, this is a common ingredient in the glues that are used in lash salons where they're individually gluing lashes to the base of your own lashes. So they're one by one putting these eyelash extensions on your eyes. So these formaldehyde releasing compounds are found in those glues. And as you can see that it can cause some irritation to the skin. You could be allergic to that component, and then you get an allergic reaction of swelling and redness on your lids. You might also have a breathing issue or a skin rash. And again, 2,000 times lower concentration of these formaldehyde releasing compounds were found to be toxic to the front surface of the eye. They are found to be mutagenic and carcinogenic. So we all know that formaldehyde causes cancer. This has been out for decades now. And yet we're allowing that cancer-causing toxin to be placed right next to the most delicate part of our bodies. A lot of people are actually allergic to this as well. And it can cause your eyelids and lashes to get red, inflamed, and scaly. I've seen that a lot in my clinic where people go and have extensions done for an event. And then it takes, 3, 5, 7 days later, they come to my office and their eyelids have just exploded with a reaction to the glues. And we have to painstakingly remove the lashes. So, okay, parabens. This is another buzzword in the beauty industry. And a lot of us have already seen packaging that may say paraben free. The problem with that kind of packaging and that kind of language is that, great, it doesn't contain a paraben, but what are they using instead? Because we need these ingredients to preserve our makeup. And so if they're not using a paraben, are they using something else? And so it's great to choose something that's paraben free, but please read the label and go back to this slide right here. Maybe you want to take a screenshot of it or write them down. And then when you go to read your makeup labels later, make sure that none of these 10 are in the label. Okay, let's go back to the parabens. And here we can see that they are endocrine disruptors, hormone disruptors, carcinogenic, reproductive dysfunction, a lot of problems here. And again, we're finding that in concentrations that are, preservatives, they're included in about 22,000 cosmetics in the US, and they're toxic to the front surface of the eye, the cornea, the conjunctiva, and the oil glands in the lids, as I was saying with the other products as well. They're an allergen, an endocrine disruptor, and it may also possess estrogen potency and an anti-androgen activity. So they may also increase the risk of cancers and malignancies. Here we are with phthalates. Phthalates are found in fragrances, nail polishes, air fresheners, body lotions, face powders, and cleansers, right? And so again, carcinogenic, endocrine disruptors, reproductive dysfunction is what we're finding with phthalates. They're used as solvents in cosmetics and makeup removers and fragrances, right, to make things more liquid. And they can adversely affect the growth of those corneal cells on the front surface of the eye, cause endocrine disruption, reproductive disorders, and they are banned in Europe but not in the US. So again, you may find packaging that says phthalate free. Great, but check the label to make sure they're not using one of the other toxic ingredients instead. Okay, tea tree oil. This is found in a lot of facial cleansers and specifically for eyelash cleansing and removing of eye makeup. Now, there was a study done at Harvard that showed that exposure of the oil gland cells when placed in a petri dish. Now, this was done in a laboratory setting where they took those cells and then added the tea tree oil at concentrations much, much lower than we would find in a product that we would place on the eyes. That again, this killed those epithelial cells, and they are an endocrine disruptor, and it possesses estrogen activity. This tea tree oil does. It's also known to induce meibomian gland dysfunction or an atrophying of those oil glands inside the eyelids. And so it can also contribute to the development of antibiotic resistance to some of the pathogens. All right, so what do we know about endocrine disrupting chemicals? Well, we can look quickly that men and women are obviously going to have different problems. But if we just look at the column of what affects men and women, these endocrine disrupting chemicals can lead to obesity and diabetes and elevated blood pressure. I mean, those are the top 3 health concerns in the US, period, right? So we're not knowing that putting these components on our face to cause ourselves to be more beautiful is actually having this profound effect on our overall health. Oh, and number 4 was dyslipidemia. So high cholesterol, high blood pressure, diabetes, and obesity. So these are significant health concerns that doctors are fighting every day with their patients, and patients are suffering from these diseases. We don't even know that we are causing them ourselves. All right, so here we are with eye cosmetic products. Again, we've gone over all of the different products that can be considered to be an eye cosmetic. A couple that I hadn't mentioned before would be this facial bleaching creams, glitter. People putting actual glitter on their eyelids, which can fall into the eyes, and those sharp little edges can make micro abrasions on the front surface of the eyes. I hate glitter. If you're one of my patients, you know how I feel about glitter. It's terrible. And then there's cosmetic procedures like eyelash curling, perming, solutions dyeing, extensions, and then we use glue and tape for adhering these lashes to our lids. All right, here we're going to talk about eyelash extensions. This is such a rave across probably the world, but here in the US, it is quite popular. I know if you're not even in the eye industry, you know all about eyelash extensions. You can see them coming before they even get into the room sometimes. And so, as I was saying earlier, it is often associated with allergic reactions. That is what I see more prevalent in my office because it's such a huge reaction when it does happen. But over time, you can also get eyelash loss. So here you are using a product that you're hoping to make your eyelashes look more beautiful, and it's actually causing your damage to your lashes because those glues can dry out the lashes, cause them to become brittle and break easily. We can get calcifications at the base of the lashes, often because those lashes are so close to the eyelid margin. We're getting an overgrowth again of that bacteria that I was telling you about with the mascara at the base of those eyelash extensions because it's a place for that bacteria to really thrive as it has another home to get into, and they can start to multiply rapidly and give you irritated lid margins and an overgrowth of that bacteria. So this can also lead to migration of those nylon fibers into the white part of your eye, or it might need to be surgically removed. And sometimes these lashes have been found to be flammable. What? All right. And here we are with cosmetic procedures that are around the eyes. And people use these to look more youthful and to defy the aging process. Yet again, there are consequences when using these improperly. So we're talking about Botox injections, fillers, PRP injections, platelet-rich plasma, microdermabrasion, microneedling, the plasma pen radiofrequency, carbon dioxide laser skin resurfacing, lasers and light therapy, intense pulse light, and photodynamic therapy, other light sources. So let's dive into a couple of these specifically. We're looking at Botox injections. They do have a great safety record, as complications will usually just resolve as the effects of the Botox wears off. So we're talking about maybe having an eyelid that comes down, a reduced function in how many tears you're making. The eyelid could come down. You could have a problem where the eyelids don't close all the way, or that the eyelid came outward or caused double vision. Again, these are temporary and are rarely seen if the treatment is done by a trained professional. Because Botox does wear off, then usually these effects wear off as well. So now we're talking about fillers and rejuvenation. Globally, over 8 million filler injections are given every year. Most of them are high hyaluronic acid-based fillers, are very popular, and they have an excellent safety profile. So those are used to add more hydration into the skin. High hyaluronic acid binds water, and so you can have a dewier, more full complexion that we lose with age. But inappropriate use of these fillers may lead to immediate or early onset reactions. You can get bruising and swelling, some infection, but nerve damage, and even vascular occlusion. Sometimes these are delayed by up to 4 weeks, and having those allergic reactions or chronic infections can really be a problem. So these are rare, but do happen with fillers. All right, other cosmetic procedures that patients and the public may be undergoing are tanning beds, tattooing, and jewelry. Cosmetics regulation is necessary. We need to teach people more about cosmetic safety and terminology, and then we'll go over a few conclusions and recommendations. Now, this portion of the lecture, I'm going to go over that specific question that was asked at the beginning of the report about the use of eyelash growth serums. And the question that was asked is the use of eyelash growth products associated with symptoms or signs of ocular surface disease. So there were 2 primary outcomes that they wanted to explore, and one was what patients would report. So participant reported symptoms based on a scale that was validated. So it wasn't just one patient coming in and saying, my eyes feel bad, and the next one saying, my eyes feel sort of bad. They wanted to have a very scalable way to measure how the patients were reacting to the eyelash serum. And then the second way is that a clinical ocular surface parameter. They wanted to look at a sign that the doctor could see. So a staining pattern on the front surface of the eye, the tear film breaking up too quickly or drying out on the front surface of the eye, and then tear osmolarity is a measure of the components in your tears if there is an imbalance of the homeostasis of the tear film. And then the secondary outcomes that were planned were looking at eyelash length, eyelash thickness, adverse reactions, and ocular adverse reactions. So they took, as I was saying, this committee is committed to learning this information. They took over 5,200 records were identified that contain something to study about eyelash growth serums, right? And so they started looking through 5,200, over 5,000 of these studies, and they dial them down, they screen them, they make sure that they are eligible for the criteria. And so in the end, they found 14 studies that were included that contained a qualitative synthesis, and 12 of these studies included a meta-analysis. So out of over 5,000 studies, we're down to just double digits of actual studies that could be included. Amazing. So what they found were that none of the 14 trials that were actually eligible for inclusion into the review of the report, none of them included either of the two primary specified outcomes that they were looking for, that were associated to ocular surface disease symptoms and signs that were actually in a validated questionnaire or a scoring system. Consequently, the report found that there's a lack of available literature, and it wasn't possible to answer the questions on this systemic review. Bummer. But that does let us know that research needs to be done. The absence of evidence in patient-reported symptoms measured by structured questionnaires. So patients saying, on a scale of 1 to 10, this is how I'm feeling. And we're not having enough studies that are actually showing the signs that are related to these eyelash growth serums. So there is evidence of them causing redness, allergic reaction, inflammation, an atrophy of those oil glands, but having a study that's looking at these specifically and measuring them over time, as there's not enough of these studies out there to be done. So future trials are needed to better understand the effects of these eyelash growth products on the signs and symptoms of ocular surface disease, so that we can educate the public about using these growth serums and knowing the actual outcomes and which ingredients specifically in these growth serums. Some of them are synthetic and some of them are natural, and both are going to have some adverse events or adverse reactions, but really knowing specifically each of these is what's important to educate the public with. So in conclusion of this cosmetic reports, cosmetics in general represent a lifestyle challenge. All of us are using cosmetics, whether we're men or women, we're using products on our face that could include these toxic ingredients. And so these products and procedures may be associated with multiple adverse events. And then you're using multiple of these products on our faces every single day. And they could cause harm or exacerbate or promote the development of dry eye disease, of atrophy to the structures of the eye long term. Because again, we're using these products day in and day out for decades of our lives. All right, more to come.
So, Dr. Theriot, I don't know if you were able to see because you were just so engaged in this amazing presentation, but I definitely encourage you to look at the feed. You got lots of love here and lots of questions. So I'm going to take some of them coming back from the beginning here. It wasn't necessarily a question, but it was something that I thought might be interesting to share. And don't forget, there's people here from around the world. So we have Benny John from India that said, if I remember correctly, there was an Ayurvedic eye hospital that used to manufacture an eyeliner specifically for children. I don't know if that was something that you had heard of before. And then we had some questions.
No, but I think that's such an important factor to point out, is that we're not talking about men and women. We're talking about children. So this is something that, we're starting to wear makeup. At what age? At what age are you allowing your kids to put makeup on? And so this is decades and decades and decades and decades of use. And as he was saying, in India, this is something that was specifically promoting to children, right? They're advertising to a younger population. Crazy. Go ahead.
And also from Benny, he was asking, is it possible that eye cosmetics with natural ingredients can prevent eye disease?
So that's an interesting question. I want to just make a point out that whether a product is synthetic or organic, it's natural, it's man-made, any of those products in a general bucket could be a problem to the eyes. Like Botox, for instance, right? It's all natural. It is snake venom, but if used improperly, it can have adverse
I didn't
reactions,
know
right?
that.
Yeah. So we can't just lump things. That's why I really encourage you guys to look at those 10 toxins. Of course, there are more. And once the report is published, we'll have a list of dozens and dozens of toxins that you'll want to eliminate from your products.
And so, Christopher, and it's kind of interesting, this diverse audience, because a lot of times you might not meet somebody who's an optician and an independent lab rep at a traditional convention, but a lot of people are really loving, whether they're from the industry or different sectors of the industry or out of the industry. If you look in the feed, there's a lot of love for this like knowledge and making this accessible. So thank you so much for sharing it. It's very deep wisdom. So Christopher says, I've seen products sold by an OD that contain tree tea oil, especially for the lids. What are your thoughts on this?
So I think at this point it's kind of a tricky question to answer. When the study was done, it was done in the laboratory in a petri dish of cells plus tea tree oil. And so we found that the concentration that killed those cells was very low. And it was much lower than what would be found on the eyes. Now, if you're talking about using a tea tree oil based cleanser around the lids and lashes, then the cells that they were looking at are actually on the inside of the eyelids. And so it's hard to correlate. Okay, they do kill these cells, but if we're using it as a cleanser and we're cleansing and then we're rinsing, are we really leaving that tea tree oil on the lids long enough to penetrate into the skin and kill those actual cells? So at this point, the research isn't out there to say that we need to ban all of the tea tree oil containing cleansers or not. I would use them sparingly until more research is known.
Now, you are a practicing optometrist, is that right?
Correct? Yes.
And do you where is your practice located?
I practice at Lust Guy Specialist in Shreveport, Louisiana.
Amazing. And, it's very interesting when you're talking about dry eye and beauty products. A lot of people don't make the connection between products that can be used as a preventative, but also products that you can use to, prevent, you could be smart about your use of products so you don't end up aggravating something that may be happening just from whatever lifestyle choices. But this is just a great opportunity for eye care professionals to answer these questions and provide new revenue streams and ways to connect with audiences. If somebody's getting Botox and getting eyelashes, they'll probably invest money in the latest treatments in ocular treatment and in the optical department. In this last few minutes, we have talk a little bit about the connection between some of these subjects and just how optometrists can enhance this, use this as an enhancement for their business.
Yes, of course. So there is a lot of talk these days in my industry about incorporating ocular beauty into your clinics. So promoting products that are healthy, that are clean for the eyes, that don't contain these toxins, and being able to either sell them out of your practice, be the educator to your patients about beauty practices that are dangerous or beauty practices that are fine to use. But this conversation needs to start somewhere, right? The ladies at the beauty counters are not going to be telling your teenage children, don't use my mascara because it contains toxins, right? Those are not the ones we need to have educating the public. It needs to be the doctors, the eye care specialists who understand intimately the structures of the eyes and what these toxins can do to them. So providing these products in your office and selling them to your patients as an alternative to other beauty products that are available. And then a lot of eye doctors are kind of getting into this space of offering some fillers or injections around the eye, radio frequency, intense pulse light, things that could actually help the eye. As I was saying earlier about the structure of the eyelids, so anything that's going to and change the structure of the lids can decrease the quality of your blink. And blinking is the most important thing we can do to coat the front surface of our eyes with our tears, right? And so our natural aging process is going to decrease the elasticity of our lids, and having procedures that perk up the lids and get them to close properly the way they did 20, 30
Wow.
years ago are important.
I
So
never thought
doctors
about
are starting
that
to offer
connection.
that.
I thought it was strictly cosmetic. I didn't realize that there was a medical benefit. And Dr. Irina Yakovin, who's the put all this together and the vision and wellness track. We're so excited to see so much great content later. One of the things she taught me as an optometrist is you have to learn to blink. I didn't know that. I didn't know you had to learn to blink properly, and she taught me. I don't listen. I try to remember, but she does. There's a way specifically to blink. We have one last question here from Lynn
Okay.
Lawrence. What is a good eyelid cleanser?
Eyelid cleanser. So I prefer a hypochlorous acid cleanser to use on a daily basis. So hypochlorous acid is naturally occurring in your own body. It's very gentle on the front surface of the eyes and your skin, and it can be used multiple times a day. So these come in bottles of a mist or a spray that once your lids and lashes are clean and free of makeup, then you can just spritz this onto your closed eyes, and it kills bacteria naturally. I call it an antiseptic cleanser, and you put that on your naked face and just let it air dry and stay on there, and it prevents bacterial growth. So that's my favorite eyelid cleanser. It's
Well,
gentle, natural.
just to close the loop, Dr. Theriot, when this event is over, we're going to be doing things over the next season, the next 3 months, called a rewind, and we'd love to connect with you and see some beauty brands that you maybe know and get them on here and let people see these products. It's really hard to find some of these products. They're not in drugstores. A lot of them you have to be recommended through an eye care professional. And there's like a couple of directories out there where you can like see products and then find a local eye care provider. But it is really important that you look for an independent eye doctor if you want access to these products, because typically that's where these things are sold, right? Where can somebody connect with a resource to say, okay, wait a second, I want to get rid of my glitter.
Right.
It's going to be my hardest thing. Wait, let me just ask you really
Right.
quick. Now, the sheen, the like sparkly sheen, not the glitter. I'm like really big into this whole thing. This whole like, let's call it shimmer, not glimmer. Is shimmer
Okay.
okay?
So we're going to have to wait for the full TFOS report to come out, because there is something about mica in there that is used as like a shimmering agent. And so I'm not sure yet because the full report's not out, but that may be safe in some instances. I will tell you all, my secret is that there is a brand called 2020 Beauty. You go to
Yeah.
try2020.com.
Dr.
There,
Diane, what's her last name?
Halal Campo. Dr.
Love her. She's
Diane
a
Halal
sweetheart.
Campbell. She is great. Now she has eyeshadow sticks that go on like a crayon, and they have a little shimmer in them, and it's eye doctor approved. So I would check those out. I really love those because they're not going to fall off and flake into your eyes all day and cause those micro abrasions I was talking about that the glitter does. So
I love that you brought up 2020 Beauty, and it is 2020 Beauty, right?
yes,
And
exactly.
Eyes Are the Story is another really good one. I
Eyes
had
are
the
the story.
privilege of
That's my
working with
favorite mascara.
I had the privilege of working with Revitalash. I still use them, and I don't know if you know the brand that founded by an ophthalmologist who invented an eyelash serum because his wife had chemo and she was so beautiful and she was devastated that she lost her lashes. So he actually invented the product without some of those things that were in the original Latisse recipe that got a lot of bad rap for some of the damage that it did. But when you talk about someone like Dr. Halil Campo and Eyes Are the Story, these are just individuals who, in some cases, are optometrists or just identified problems, and they just innovated. They innovated these solutions. I was actually speaking with Dr. Halil Campo when she started founding 2020 Beauty. She's a very young company. So if you're looking to support a woman-owned business and an optometrist who just saw too many patients having these challenges that she decided to solve a problem, that's just a great product. So I'm glad that's the one that you mentioned.
Right. And again, Eyes Are the Story. They have my favorite mascara because it comes in those, and it comes in a mini tube. It's only like that big, and you throw it out once a month. So I'm kind of obsessed with the cleanliness of my lids and lashes. And for me, throwing it out once a month is magic. Love it.
Well, and when you talk about, we're here in the Web3 space, you're here in the Metaverse with us today talking about dry eye and ocular beauty, like shout out to milestones, right? And, this is a generation that, embraces sustainability and embraces wellness, and they want to be educated. And, they realize now that reading some of these blogs, they're just getting manufactured marketing. They're not really getting true information. So we hope you guys enjoyed this straight from the source. I mean, it was so great that you even shared the source of where this great data came from. I bet you some of those people developing those eyelash serum studies would find great value in discovering AI, because some of that data can be fed into AI and develop all sorts of conclusions. So it'd be really exciting to see how studies like that evolve as researchers start embracing artificial intelligence and its ability to interpret this information and even create projections of societal impact. So we're in such a fun era, aren't we?
That is, it's incredible.
So we'll take last minute questions and then we'll end. Just some of the feeds here. Somebody mentioned Zocular. It's ochre based.
I love that brand. Yeah,
Almond,
it's a great cleanser.
Almond olive oil remover. What do you think about that? Is that okay?
I don't know that one specifically, but both of those two oils could be great emollients. They can loosen the mascara that's on your lids and lashes and be able to pull that off. While I'm on that, I want to tell you that waterproof eye makeup, bad. Don't do it.
Really?
So, yeah, a lot of dry eye patients.
Oh, go ahead. I'm sorry.
That, and because of toxins. But I think a lot of dry eye patients who have like irritated, watery eyes, they're like, oh, let me use waterproof because then I won't cry it off. It won't fall into my eyes if it's waterproof. But waterproof mascara contains more toxins than regular mascara. And so bad.
And being in the industry, I'm on my kids all the time about rubbing their eyes and, early stage dry eye disease. And, are you seeing this trend of younger people having early stage dry eye syndrome?
So personally, I don't see a lot of children in my clinic just because of the setting that I'm in, but my colleagues report this daily, that it's becoming an epidemic, that because children are using digital devices for so many hours. And the key thing that our digital devices do is decrease our blink rate, right? Yeah. That's why I was saying we're going to learn that blinking is so important. And so when we don't blink, we don't refresh the front surface of our eyes, and we don't spread the tears out and give our eyes the nourishment and moisture that they need.
So we're going to do a rewind later in the season when we can coordinate, and we're going to bring some experts to come in and talk to parents and to even businesses. If you've got employees that don't know how to blink properly and they're working, 8 to 10 hours a day on a computer, you're going to have people having shorter, time periods of working, migraines, all these sorts of things. So all of these ergonomical factors are going to be important. And we're just so excited that we're able to create that access point to the industry. So thank you guys for joining us today. Dr. Theriot, thank you for that wonderful presentation. And for all of you,
welcome.
You're a great audience. Go ahead. I'm sorry. Thank you. I'll give you the last word.
Thanks so much for having me today. If you'd like to learn more about ocular surface disease, dry eye, and beauty, I do have a blog, and it's available at my website, which is www.pamtheriot.com. And Theriot is spelled the riot, pamtheriot.com. Easy peasy. And there's a ton of information there about what I was speaking about today.
Thank you for being with us. We'll see you soon. Bye.
Thanks for having me. Bye-bye.